This is Cicely. She is an 18-month-old Great Dane, and she's a very sleepy girl right now, as you can see. Today she's going to have her spay, which is a complete hysterectomy, and we're also going to do a preventative procedure called a gastropexy. So the reason we do this is to prevent a potentially fatal issue in the future called a dilatation volvulus, also known as a GDV or a bloat. So this is a very serious and, like I said, sometimes fatal condition, and a lot of dogs don't survive when this happens. So what happens is their belly fills up with food and a lot of gas, and it basically rotates, and it cuts off their circulation, and they get, hypovolemia very quickly. So we're going to prevent that from happening. We're going to tack her stomach to basically her body wall. So we're going to get started. So right now we are prepping for our spay and our gastropexy. We're putting our sterile towels down, and the first incision that I'm making lower is for her spay, which is a complete hysterectomy. I'm removing her uterus and both ovaries, is kind of what you're seeing right there. And we're just, I'm ligating everything to make sure that we don't have any bleeding. And then I'm going to close her body wall and her skin on that incision. And my assistant is a student from Mississippi State. She is just going to help me visualize where I need to go for the gastropexy. So right now I'm going up higher to the sternum and the ribs. So with the gastropexy, I'm making an incision on the exterior wall of the stomach, and then finding the adjacent rib and making an incision in the body wall. And I'm actually tying the stomach to the body wall so that way it can't flip over in the future. It's just a little difficult to get visualization on a deep-chested dog like this, so it does help to have a second person to hold. And right now I'm closing the body wall and the skin. So she does have 2 separate incisions, and we are done.